Well, the security of state hospitals is indeed under the spotlight after criminal attacks on two female doctors at the Pelonomi Hospital in Bloemfontein. Well, the Department of Health has already put in place urgent security measures at this hospital. Dr. Chris de Kok is an independent crime and security expert. He joins us now from our Pretoria studios. Good afternoon, Doc. Thank you so much for your time on the SABC News Desk. Apologies for the slight delay.
Good afternoon, and good afternoon to the viewers.
Doctor, let's start. The shocking frequency of such attacks on health practitioners leaving us all very worried. Why have our public hospitals become such a soft target for criminals at this juncture?
Well, I think for two reasons, and especially why doctors and the nursing staff have become the victims. Is, they have got items like motor cars, like cell phones, like money and all the other things which the criminals want. Also, I think one of the other reasons is it's very difficult to secure hospital facilities, clinic facilities, and even the other worrying factor is your ambulances and your emergency staff going to help people in the case of accidents and so forth, the paramedics. Now, all of these people have got items which the criminal want. Like in the latest incident at the Pelonomi Hospital. All right, the first case was this guy wanted to rape this doctor. And then a few days later, on yesterday morning, we saw that it was attempted, it seems according to the media, attempted hijacking in the parking area. So the rape is a little bit different from the one of the hijacking. But it also illustrates the fact that two of these incidents can happen within a few days apart after the hospital have tried their best to implement some extra security. I mean, the minister even visited the hospital on Friday afternoon or on Friday, and he said he's now happy with the extra measures. And then on Saturday, you find a attempted hijacking indicate that it is difficult to secure such facilities.
Yes, Chris, we heard the Department of Health yesterday, in fact, say that increased security measures like better lighting, stronger surveillance, and fortifying access points, etc., are being implemented. But like you're saying, we saw another doctor robbed. What more can be done at this point from a security perspective?
Well, I think we should, if we had time, we should have started with the community. I think really the community have to understand that if doctors can't operate and give their full attention to what they are there for, it's going to be difficult. So I hope the community give information to the police. Then we should get our police to work properly, because clearly, in this case, again, the police have failed. And then we come to the facility itself. Now, to secure a facility like that, any medical facility, any kind of facility with the same characteristics, is quite expensive. It doesn't help you to just put a wire fence around the facility, because that can be cut in a few seconds, basically. It doesn't help you to put a palisade fence, because that they broke into in a few seconds. You now have to look at fences, for example, periphery fences, like something like Clearview, your Secureview type of fence, with electric wires or electric fencing, plus cameras which will be triggered, like beams. It will be triggered and send a signal to the ops room. And then also, it is difficult to control the people going into a hospital, because some of them are there for consultation, some of them are there to visit friends and family, or even to come and visit there. And then there's the staff itself. But you will have to have much stricter control, access and entry control to a hospital. through one entrance, basically, where you will have to search people for firearms, for knives, for that kind of weapons.
Doc, this kind of incidents, or these incidents rather, it also raises questions on the presence and the role of private security companies. Now, what factors should hospitals or the Department of Health be taking into account when selecting a security company to keep premises safe 24 hours?
Well, they should look at the record of the company, and they should also look at the vetting of the personnel of that company. Are those people properly vetted? Can we trust those people? And then also, as I say, if an incident like this happened, that we had 2 breaches of security within literally 3 or 4 days from each other of this seriousness, and now the university had to suspend their training program at Pelonomi, that security company really have to do some explaining. And if they can't explain what happened there, well, then maybe it's time to get another security company. We are paying a lot of money for security companies. This is not, they don't come for free. And I think the record of that specific company, I don't even know who it is really dismal. They have some explaining to do.
Dr. Chris de Kok, I'm afraid we'll have to leave it there. He's an independent crime analyst joining us from our Pretoria studios. Thank you so much for sharing your invaluable insights with us right here on the SABC News Desk.